So our Olmsted plan is really about a sea change amount of work over a long haul, where we've had many committees working on issues like housing and transportation and service arrays and navigating the necessary will and change that we need to make those happen. Taking that plan and adding numbers and financial investments is the offshoot that we're talking about today. So what we'll see releasing here shortly is particular financial investments that we're calling on to be made in the next year that speak specifically to waiver slots and specifically to direct support professionals and the workforce crisis, and starts to pave a path on what we need to see over the next several years to make those changes as well. The Olmsted plan is the umbrella body of work. It's just as much about the big systems and policy changes as it is about building the buy-in and the collective partnership that we need so that everybody's on board to make these changes. And then this offshoot is really a more tactical, very specific things that we want to see immediately to double down on our investment in serving people with disabilities. So the order as written says that the front door of community-based institutions, ICFs, including small group homes or institutions that serve people that are incredibly medically fragile, the front door of those facilities has to be shut. When you have a 6-bed group home and new admissions cannot happen, after you have 1 or 2 open beds in that facility, then you can't continue to sustain that facility and operate it financially, which means those facilities will end up closing. And when you shut the front door of any business, leading up to the date where that happens, I have serious concerns that we'll have a mass exodus of providers that are doing that work, right? We can't have that. Those 6 individuals that live in that small group home, or 10 individuals, or even more that live in a facility specific for folks with medical fragile needs, we can't have them pushed out with no options to go. You know, I think back to the 70s when there was a big movement to close down large facilities, which was the right thing to do, but it was done before community-based services were available. And we saw increases in homelessness, and we saw increases in individuals with mental illnesses ending up in jails. We do not need to repeat that history, and we need to build more community-based services and work together, and again, lean into choice, giving people choices. I want every single one of those people to get services as soon as possible. And frankly, I don't believe a decade alone is even ambitious enough. That's why not only are we calling for more investments in innovation waiver slots, but it's also why we have been using state dollars to support individuals that don't currently have waiver slots to make sure that they can get services too. And actually, if we expanded Medicaid, we could free up a lot of state money that we currently have and use it to support more people with disabilities. And the last thing is that the 1915I state plan amendment that we've done with Medicaid allows us to pay for more services using Medicaid for those people on the wait list as well. So yes, we need to serve all of those people. And what I worry about the current structure of the ruling is that waiting list would get even longer if we started to have wholesale facilities closing down. So we've got to serve those people, and we have to do it fast.